I operate at many different hospitals, and the special thing about Hamilton and its orthopedic program is that the specific attention has been paid to making the post-op care better. And that's what I see. The difference is in post-op care. We're the same, right? So, at any different hospital, I'm going to do surgery, and I do it the same way, and I have a team, and I'll put a knee in, and I'll put a hip in, and it goes in the same way. What makes a difference is the post-op care. And so what you get at Hamilton is the nurses are well trained and right on top of things. So in the next day, I'm getting a call. Listen, he's getting out of bed, he's doing this, he's doing that, his blood count is this, what would you like to do? Whereas you don't get that at other hospitals. And so that is the special thing about Hamilton and its program, is that it's all about the nurses and the post-op care that's been established. The other thing with the blood transfusion is also a special thing that's only happening at Hamilton. The tranexamic acid that is being used both in surgery and right after surgery has reduced the blood transfusion rate to a significant extent. So that really improves post-op care too. So, what causes pain afterwards? It's the surgery, but the surgery surgery pain is really limited. It's the swelling and the inflammation that happens, and a lot of it is contributed to by bleeding. And when your joint becomes full of blood, then it causes pain. And if that doesn't happen, then you don't have pain. These patients are walking around as if nothing ever happened. This morning, my patient, they were commenting, he's sitting at the edge of the bed, like as if he was at a picnic. So that's a difference, and that's a difference that needs to be talked about. So I think it has to do with the care that the nurses are providing, because they're better trained in this, and the program as it's set up with these little things, these little nuances with the tranexamic acid and the getting them out of bed the morning of. There are patients at other hospitals that sit until late afternoon, evening, and the next day, and they have had a joint replacement. That doesn't work. And so you see that difference at Hamilton. They're up and about the same day, most of the time, and if not, the next morning. So it makes a difference.